Sounds good. Well, welcome everybody for being here for our very first webinar. This is the Central Florida Wellness Council, and we're going to be holding these webinars, hosting them on Blab on the third, Monday of every month. So for now, we're going to have them recorded. You're going to be able to access those online. We're probably going to have that on a YouTube channel. For now, if you could go to our website, that's going to be centralfloridawellnesscouncil.org. We'll be able to keep you posted on where we're going to be putting those webinars as we start archiving them. So for our very first webinar, we have our very own Dr. Colin Bartoe. Dr. Bartoe is our wonderful, amazing executive director for the Wellness Council, and we couldn't live without him. But on top of that, he is an expert in functional neurology, which we're going to be covering tonight, asking questions about it. He's a chiropractor, speaker, educator, small business owner, and I'm going to let him introduce himself a little bit about his story before we start with the questions. So, Dr. Bartoe?
Well, thank you. That was a very kind introduction. So I am a chiropractor, and I fell into chiropractic because of my own personal back pain and problems and all of that. But once I got into the chiropractic study, I realized I couldn't stop asking why. Why are some patients getting better? Why are some patients getting worse? Why are some patients not changing at all? And that led me to functional neurology, also known as chiropractic neurology. This is a study and an application where we are able to assess and treat the nervous system in a way that it's really not being done as much in our mainstream healthcare system. So we'll get into more of what functional neurology is in a minute, but I am a Florida boy, solar powered, grew up in Fort Lauderdale area, went to UCF, go Knights, and then went on to Life University in Atlanta. I have over 500 hours of training in functional neurology, including vestibular disorders, movement disorders. I've worked with stroke. My talk this past weekend at the Vicasa Expo was stroke rehabilitation using functional neurology. And I talked about a case that I had the abstract published in a neurological journal. So there's a lot of fun stuff going on in the field, and it's ever expanding, ever growing. So other than that, there's a lot to know about me, but
there's a lot to know about Dr. Bartoe, including his love of skydiving, but that's for another webinar, another day.
Very extreme adventure
webinar. Let me start by just asking you what functional neurology is. I have asked you this question before, and I would love to have your definition of it on here.
Absolutely. Functional neurology, the easiest way that I can describe this to somebody that has no idea about neurology or what we're doing is to relate it to physical therapy. Most people are familiar with physical therapy to some degree in the fact that if somebody gets injured, say they injure their arm, we go ahead and we assess what the damage is, and we start recovering them very gently. And then as the arm starts to get stronger and stronger, we can add more and more weight, more reps, more exercises. We can really just make it more intense until the person is back to a fully functional limb. In neurology or functional neurology, we do the same thing for the brain. We utilize something called neuroplasticity, which basically means that we can rewire the brain. We can help brain cells become stronger in their job, and we can actually help to teach other cells to take up the functions that are lost during certain types of brain injuries or developmental disorders. So we determine the area that needs to be corrected, and then we can exercise that area through directed brain exercises and really create a stronger brain cell and a stronger connection to other cells, allowing us to return function, which is quite a big thing when it comes down to somebody living their life and enjoying their life.
Can you explain how it's directly related to chiropractic?
How it's directly related to chiropractic?
Yeah.
Yeah, absolutely. Sorry, my screen is flashing. I'm trying to figure out what's going on with it.
I heard an echo.
Yeah, there was a little bit of an echo. Let me see if I can get a little closer here. So the cool thing is, it began with chiropractic. It started believe back in the late 80s or so, maybe the early 90s. Dr. Frederick Carrick was the one who really made big waves and brought this to chiropractors around the world. And it started in the concept that when we adjust somebody in chiropractic, when we manipulate the spine, we're doing more than just taking pressure off the nerves. We needed to understand what was actually happening, and that research began to grow. And as research and study on what was happening improved, as we were able to really define the processes in play, we learned that we could affect the output of the brain by applying different exercises. So chiropractic-wise, the adjustment is probably the most powerful tool that we have. When we adjust a spine, or even a limb, an elbow, a wrist, whatever, we can create a massive barrage of information to the brain. Kind of like, a small carpet bomb versus a nuclear warhead, right? So huge difference in the amount of power here. And so a lot of the patients that we work with as chiropractors, we're aware that we have this very, very powerful tool, but we don't always apply it directly out of the gate. Sometimes we have to, in a lot of cases, we have to know that the patient is able to handle that level of care. And I have story upon story upon story of patients that you wouldn't expect it, but with an adjustment, they had a bad reaction. They would be dizzy, they would get headaches, pass out, different things like that. So we can see how, and sorry, I'm talking with my hands here, so you like thumbs moving. You can see how powerful that is when you look at the reactions in certain fragile individuals. Now, of course, the more damage there is to the brain, the more fragile, but to make it a little more personal, I use myself as an example. And when I was teaching neurology in chiropractic school to the students and the doctors that would come to our club, I would tell my story about how there were times where I couldn't handle an adjustment. I would literally go third person. I could see myself walking around like a video game. I would have no emotion. I didn't care about anything. And I fought to keep myself moving forward. And I ended up working with an incredibly talented doctor to get my brain back in gear. But you'd never think of it to look at me. I was always athletic. I was always involved with stuff. I was always doing things, always relatively fit and eating well, but my brain was challenged. So I had to rehabilitate my own brain before I could move on to rehabilitate others.
Really cool. So we have a mutual friend that you're treating at the moment, her son, and I won't disclose any more than that, except that he had a bad car accident and some brain injury, and it got me wondering what types of conditions would functional neurology benefit, whatever the brain type injury or disease it might be. Could you explain some of the conditions, some of the people that might call up Dr. Bartow and ask for your services?
Well, hopefully they're not just calling me, but they're calling every functional neurologist, depending on where they're at. So yeah, it's really one of those things where it's across the board. One of the things that I'm very passionate about is post-stroke rehabilitation. When somebody has a stroke, it can affect their lives very, very deeply. The case that I talked about during the expo this past weekend was a gentleman that had 5 strokes over the course of 10 years. He had 2 strokes within 72 hours of each other, about a year before he came to see me. When he came to see me, he was not able to dress himself. He would wear t-shirts and polos, things that he could pull over his head, because he was no longer able to button his own dress shirts. He was not able to button his pants or put his belt on appropriately. So his wife had to take care of him. And by working with him, we were able to give him that capability back. So he was able to dress himself. He was able to sign his name. He was able to speak better. There was a lot of different things. We could talk about that later if you'd like. But everything from stroke. I've worked with Parkinson's disorder patients. Let's see. I've worked with developmental disorders and autism. Balance disorders is another really big one. The one that I'm really pushing right now to build my practice with is concussion, brain disorders or brain injuries. Traumatic brain injuries is something that's been huge, big buzzwords around the NFL and around the country in the past year or two. But what we're seeing is that a lot of the research is pushing toward, especially with the NFL, how can we protect their heads better instead of how can we not demands. But it goes beyond sports because we're seeing students and kids, like you were talking about with our friend's son, who was involved in a car accident. I've had 3 or 4 people who were involved in car accidents hit their heads, and they had brain-based conditions after that where we had to improve their ability to function, to think, to focus, to see things appropriately. So it really spans a very broad range. And to be honest, it could be anything. It's not just limited to the brain itself. It could be a peripheral nerve disorder, nerve entrapments, or conduction problems, multiple sclerosis, different things like that. So my kind of running motto with this is, when in doubt, call me. You don't know what we can actually do until we look and see where the condition is, where the problem is, where that functional deficit is. But once we figure it out, we can move forward.
So if we have an athlete that had a traumatic brain injury and is having trouble with memory loss and like certain, maybe emotional conditions, rage or whatever, would that apply in this case? Is that something you could take a look at? Absolutely.
One of the things that I've had a good bit of experience with is working with athletes that have had traumatic brain injuries. During my time at Life University, I worked in a clinic with Dr. Carrick and a number of his top doctors. And these are the go-to guys in the world. I mean, we were seeing professional athletes, Olympic athletes, Hollywood elite. We were seeing the best of the best because they needed the best of the best in care. And the best part about this was that the facility was mostly volunteer staffed by students in the neurology club. So these students were given an incredible experience to work at a very high level and work with athletes. So one of the patients I can actually talk about, he did press conferences about it, but Sidney Crosby, the captain of the Pittsburgh Penguins, fantastic hockey player, but he had 2 concussions. And I can't go too much into that, but we had him back on the ice, and we actually got him working again. And then there's a number of other athletes, and it doesn't have to be just professional level. I worked with one of the cases I had. My first one in Florida after I graduated was a 14-year-old boy that had 3 concussions, just roughhousing with his friends and playing football with his friends. He got kneed in the temple, so he wasn't able to read. He had headaches, eye pain, all these different things, and with just a few simple exercises, we were able to give him back a lot of that functionality. And then ultimately, the big emotional take home was his mom came in crying one day because her son smiled and he had emotion. So it was really, really powerful.
Wow.
And I'm seeing here, what type of testing do we use to diagnose and treat? I'm just going to go ahead and field this if that's all right.
Yeah, I was going to ask you.
So April's asking, what type of testing, if any, do you use to diagnose and treat? So diagnosis for functional neurology is a series of standard clinical medical neurological tests. Things as simple as follow my finger. Okay, see if you can bring your eyes together, if they can track, if they can jump fast, making sure you can feel, your face, your hands, your legs. We check to see if you're able to feel temperature, if you're able to feel pain or prick, or whatever the case is. Move coordinated. There's a lot of different things that we do. Some facilities are also equipped with some very fantastic equipment. One of them is video nystagmography, which basically means we get to video record your eyes while they do these movements, and we can graph it out. We can play the videos back. They also have force platforms, which allow us to see where the center of pressure is in place, where the person feels they are in space. Now, those tools can be quite expensive, depending on how high end you want to go. But any of these tests can be done by a trained functional neurology practitioner. And you can really learn a lot about what's going on with a person just by looking at all of the motor outputs and their cognitive processing capabilities.
April makes a good point. It does sound not very invasive as a procedure to diagnose, and also the 2 expensive pieces of equipment, though, that you mentioned would be great for someone who was nonverbal, that you couldn't ask these types of questions with, or perhaps have as much control over verbally when you were diagnosing them. Sounds interesting.
Yeah, and there's other equipment that we use too, different treatment modalities that give us less invasive and non-invasive applications that can really, really ramp up brain function. There was one I got to work with. We call it a multi-axis rotating chair. And this device actually, we put the person in, put them in a 5-point harness, and then we spin them forward or backwards, left or right, or any combination of those. And it activates the inner ear in a way that nothing else does. So that was a really powerful treatment that we were able to use in the past.
Wow.
Yeah. I'm still hoping to get one of those in the future. They're very, very hard to get.
Be a fun thing to use, though. And she said, I thought for sure you would say MRI. I thought the same thing. Would you ever use an MRI result or request one?
Absolutely. Understanding the structural aspect of the brain as well is very important. And I do review MRIs on occasion, depending on what the case is. But the work that we do in functional neurology is more directed toward what is the functional capability of that nerve cell. Is the nerve cell able to do its job? And that's something that's very difficult to image on an MRI or a CT. So we can look at those and they help us as far as, hey, there may be a tumor, there may be a clot from a stroke or something like that. There may be an area that's losing mass, it's losing cells. But in the long run, we're working with how is the brain actually working? How is it functioning? How is it able to do its job?
Mm-hmm. Hence the title of the talk, The Function of Neurology. I see where you went with that. So could you maybe give one more example of a neurology or functional neurology case you've had besides the man that you had mentioned before with the stroke, just to give an example of kind of the dynamics or the large scope of practice you're able to, or scope of patients you're able to address?
Yeah, and since concussion is such a big thing for me right now, I'll talk about one of my recent cases, which was amazing. Well, actually, there's two. The reason I'm bringing up two is that they are a boyfriend-girlfriend couple. And wow. The first one, the man got the concussion while he was longboard skateboarding down some pretty big hills. He fell and smacked his head, and even through his helmet, he broke the helmet, broke his skull, and actually had a bleed in the brain. He was in a coma for a couple days, and when he recovered, his friends knew about me. They had met me, so they sent him my way. Within a few weeks of working with him, we had him in a position where he was able to recover from not being able to organize, not being able to focus. Now, this is a very driven individual. This is a national team, Olympic team level swimmer, athlete, athletic coach. So for him, that ability to focus and be on target all the time is very, very important for both his career and his personal life. So we were able to get him back on his feet and doing just as well as before. And then a few months later, his girlfriend suffered a concussion as well. She was doing some Olympic lifting and actually headbutted the barbell. So gave herself 2 black eyes and gave herself a concussion. And since she was out of town, she came down for just a week over the winter break here. And in the course of that week, I ended up treating her every single day, except for Christmas Day. And in that 1 week, we were able to manage almost a full recovery. So it was really,
wow.
really, yeah.
That's amazing. That sounds really painful too.
It really does. That poor girl. She's a boss though.
So aside from running into a barbell, how would you know that you needed a functional neurologist, and where would you find one?
Yeah, so most patients find functional neurologists when they've been to a number of other doctors. They're not able to find help. They keep getting told that it's either in their head or perhaps it's something that that they can't help with. And it's very, very common for me to have patients call me and say, hey, I've tried everything else. What do you have? And that story is repeated over and over and over through functional neurology. So here's the deal. Anytime you have a brain problem, whether it's your thinking, your moving, your feeling, anything that your reality is altered, that's a good time to talk to a functional neurologist. And I always recommend personally seeing a functional neurologist first before seeing, if it's not an emergency situation, I just want to clarify that, before going toward medication and surgery, because when it comes to the brain, changing chemistry and actually cutting into the brain are very, large impact types of therapies. So I would never say don't do it, but I recommend trying least invasive or lesser invasive applications beforehand.
Right.
And any functional neurology doctor will be smart enough, and I know a lot of us, any of them would be willing to say, hey, you need to go see a medical doctor first, and then I'll follow up with you if the case needs it. So it's not something where we're trying to supplant medical neurology or say that we're better. We're just different, and we offer a more holistic application to what's going on.
Very cool. That's very cool. Well, does anybody have any other questions? Mike or April, I see you guys kind of chatting on there. Is there anything that we didn't cover, maybe specifically for autism, or any other questions you might have?
Oh, that reminds me. Insurance. Okay.
Yes.
So April asked about insurance. Now, there are functional neurology offices that take health insurance. Some do, some don't. It really depends on the doctor. And from what I found, I'm a cash-only practice, and I've chosen to do that because it gives me more freedom to do what I feel is best for the patient. But also, it's difficult sometimes for us to get reimbursed for those things appropriately, even though it's within the scope of our practice and we are trained to do this. Insurance companies are still not aware of exactly what we're about here. So I'm going to let Michael join us.
Hello, how are you?
Hi, Mike. How are you?
I'm incredible. Do you know anything about cerebral palsy? What do you know?
Do I know anything about what now?
Cerebral palsy.
Cerebral palsy. Yes. Yes. I actually got asked this question the other day when I was speaking at the Casa Expo. Cerebral palsy, for those who are not familiar, it's an oxygen deficiency event, generally is how it's defined, at birth or around the time of birth. So basically, it creates a situation nearly like a stroke would be. It's kind of a similar process where the brain doesn't get enough oxygen. It really depends on what parts of the brain are affected, as to how the symptoms are presenting and how far treatment and therapies can go. The beauty of this is I actually was given a firsthand kind of passenger seat journey along with a friend of mine who had cerebral palsy through chiropractic school and through functional neurology training. When she came in to see us, she was relatively higher functioning with her cerebral palsy. She still had difficulty walking. She had difficulty with some of her processing and some of her ability to maintain her endurance. But as we were learning and working with her and treating her as students, we got to see some really cool improvements. But I always preface this by saying with any case, it always depends on the individual case and what any of the limiting factors might be. So there can be amazing changes, but it depends.
Okay. What sort of changes have you seen?
Especially with my doctor friend, she was able to walk better. I mean, it's not nearly as drastic as the end of Usual Suspects, but it kind of felt like that to us, where she was able to walk more naturally. Her endurance, both for her brain and her body, increased. And she was able to finish the doctoral program, become a certified functional neurologist, and continue to work in the field at a very high level.
Oh my God.
Yeah.
That is incredible. But,
yeah.
My goal is to get my speaking.
Speech was actually part of what we did with her as well. It really, as far as treatment for speech, there's a lot of fun things that functional neurology can do in conjunction with other like speech therapy. We use similar approaches, but we can get a little bit more detailed and we can look at more fine points as far as improving specific parts about speech.
I live in Canada.
Yeah, we've got some guys up there too.
You do? Who?
Yes, there's a website.
Who? I want to know who.
I'll go ahead and put it in the chat. It's www.acnb.org. It's the American.
That's what I was going to ask you to post.
What's that?
I said that's what I was going to ask you to post, the provider information.
Yeah. So
and April has a question as well.
I definitely will be in touch with them.
Absolutely.
Great.
Check it out. There are doctors all over the world. And if you need anything, if you're not able to figure something out, feel free to email me. I'll put my email in there as well. It's drbartoe@gmail.com. And I'll do what I can to help you find somebody. And if you have to travel, I'll point you in the direction of the best guys in the world.
I think that April had a question similar to that she says when someone wishes to seek out a provider of services such as what you are describing and they can't find one affordable in your area, what would you recommend as an alternative?
Okay. So Mike, I'm going to go ahead and take you off of video and bring it back just to Lauren and I. If you have any questions. What's that?
Thank you. You are incredible.
Thank you, Mike, for being on here.
If you have any more questions, let us know. We'll bring you back in.
Don't worry, I will.
I love it. All right. So,
a million.
All right.
Yeah.
I'm going to drop Mike out there. All right, cool. So when someone wishes to seek out a provider of services such as this, and they can find one that's affordable in the area, what would you recommend as an alternative? All right, so if you're not able to find a functional neurologist, try finding a chiropractor in the area who's willing to learn. And I say chiropractor because that's where it started. And having the mindset of a chiropractor coming in where we're not looking to alter the body from the outside in, we're looking to help the person express the health that they already have, the health that's there. Those individuals, for me, have been the ones that most readily take to this type of perspective and the way that we treat. Aside from that, traveling is your best option. We've had people travel from, East Asia. We've had people travel from different parts of the country to see the doctors that we've worked with or that I've worked with in the past, because when you need that level of care, you sometimes have to travel. Now, I will tell you that April previously, before we started the broadcast, was talking to us about autism and spectrum disorder. And so with that, there are some books that you can read. And there's a gentleman named Dr. Robert Melillo. And Dr. Robert Melillo has a few books. The first book he wrote was called Disconnected Kids. Good, you've heard of him. Awesome. The second book is Reconnected Kids, and the third one is Autism. Those books can give you a very solid insight, even for the lay, non-practitioner kind of person, insight into all of the different factors that are coming into play. Now, these are books that we actually recommend for any functional neurology practitioner who wants to work with spectrum disorders, because they provide us as students when we're coming up the foundations, but it shows us what kind of information and how we can present it to patients to help them better do the home exercises and help them to take that into their own hands. So that may be a good way for you to start that journey, start learning what factors may be triggers for your son and those types of things. I hope that helps. If you need, I can actually try to post a link down in the chat for you. Okay. So I'm going to go ahead and grab that.
She had another question about a chiropractor if you had rods in your back due to past scoliosis surgery.
Awesome. All right. So in this type of a situation where somebody's had surgery on their spine in the past, I highly, highly recommend chiropractic. And a lot of people think this is a little bit off kilter, or it might be a little shocking to some people. But let me put it to you this way. When you take a system of joints, right, and they're supposed to move, and we lock it in place, well, now that joint is not moving. The joints on the top and the bottom of it have to take up all of that extra motion. They are forced to move more than they should. So when those joints have an imbalance of muscle tone, they have an imbalance of wear and tear, then they will end up breaking down more rapidly than the rest of the spine. Also, I have a couple patients right now that have surgery, or they've had surgery on their back. One I can think of directly off the top of my head was a girl who had a very extensive scoliosis, and she had to have, I believe, 4 or 5 surgeries to straighten her spine. They put Harrington rods in and all this different stuff. Well, she still gets back pain to this day because she has muscle spasm along that. Now, a lot of chiropractors adjust. No, every chiropractor should adjust. But a lot of chiropractors will also use muscle and myofascial techniques to help reduce muscle spasm and to help open up the tissue so that the muscles don't create that pain syndrome. Also, on top of that, looking for functional neurology as an intervention. When you have chronic pain around a post-surgical site, understanding how those pain pathways are transferred and understanding how to squash that pain from the brain can be very, very beneficial for a patient. And I've had to do that in the past.
Too bad April doesn't live in Orlando.
Yeah, I know. I was going to say, if you live in Orlando, I can help you out. But
you need to go to Disney World.
come visit the mouse and the doctor.
That's right.
I've actually, as my practice has been building here in Orlando, I do chiropractic adjusting and myofascial release. It's a very gentle myofascial release, and I use it for helping competition athletes as well as the average Joe. But I'm having patients now travel. I think my farthest patient so far is a 2-hour drive from Tampa to have me work on her because nobody else has been able to actually help out with her condition. And that was an athlete. But the neurology cases are starting to come in from farther and farther away as people are understanding what we can do with functional neurology.
I bet as it kind of picks up, you're going to be seeing a lot more patients too once they start understanding the background behind it and the benefit of it. Yeah. It's incredible information, Dr. Bartow. I really appreciate your time. And if there aren't any other questions, we'll probably wrap it up and see what I need.
Before we go, I just want to say that anybody watching this now or in the future, if you have any questions and you want to get a little more information, I'm always free to talk to. I'm happy to share. I love to teach. It's a passion of mine that I won't ever give up. But you can contact me at drbartoe@gmail.com. You can also check out my website, drbartoe.com. Go ahead, read the reviews on Facebook, read the reviews on Google. If you have questions, talk to me. I'm happy to answer questions. And I'll be the first one to tell you I don't know everything, but I am absolutely willing to look it up and try to figure out what's going on if I don't understand it. So we'll always do whatever we can to help patients live their life to the fullest. And I pride myself on giving good quality care to patients at a reasonable rate. So we make things work, and we can find other people to do the same if we're not able to here in Orlando.
We really appreciate your expertise in Orlando, let me tell you, because you are a diamond in the rough, so they say. You've got a wealth of knowledge, and our Wellness Council really appreciates having you on board as well. Just as a quick reminder to everybody, we'll have these webinars on the third Monday of every month. They'll be archived, so this one will be archived if you want to go back and listen to some of that information again. But we appreciate you, Dr. Bartow, taking your time out of your night for this, and hopefully you guys will tune in next month.
Thank you, everybody, for coming out, and see you next month.
All right. Bye-bye.